Hello, my name is Eveline Tira Remy. I am going to read the Unit 2, the exercise, chapters 5 to 13 from this book, Professional English in Use Medicine. Chapter 5. Exercise 1. Write sentence to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist specializes training in inflammatory diseases. 3. Traumatology. A traumatologist specializing in trauma. 4. Pediatrics. A pediatrics specializes in primary care children. 5. Obstetrics. Obstetrics specializes in delivering babies and caring for people during pregnancy. Exercise 2. Complete the table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, specialize, non-person, specialist, non-activity, specialty. Verb, practice, non-person, practitioner, non-activity, practice. Verb, cancel, non-person, consultant, non-activity, consulting. Verb, assess, non-person, assistant, non-activity, assisted. Verb, graduate, non-person, graduated, non-activity, graduating. Verb, qualify, non-person, qualified, non-activity, qualifier. Exercise 3. Find preposition in C opposite that can be used to make word combination with the words in the box. They use the correct forms of the word for complete the sentence. Good, interested, specialized work. 1. A pathologist is interested in diagnosing disease through examining cells and tissue. 2. A pediatrician must enjoy work with children. 3. An oncologist specializes in the diagnosis and treatment of cancer. 4. A psychiatrist must be good with counseling. 5. A neurosurgeon must be good with her hands. Exercise 4. Make word combination using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. 1. Consulting rooms. 2. General practitioner. 3. Group practice. 4. Health center. 5. Internal medicine. 6. Surgical specialties. Chapter 6. Exercise 1. Make word combination using a word from each box. Look at A, B, and C opposite to help you. 1. Associate specialist. 2. House officer. 3. On call. 4. Provisional diagnosis. 5. Radio pager. 6. War room. Exercise 2. Match the descriptions with the job title. Look at A and B opposite to help you. 1. Dr. Rem has been pediatrician for 8 years and is responsible for training the children admitted to Ward 16. With the letter C, consultant. 2. Dr. Stewart has just started the second year of the foundation program. With the letter D, CHO, senior house officer. 3. Dr. Sen has started his training as a surgeon with the letter A, a specialist register. 4. Dr. Phillips has just graduated and he's working in a large hospital in Birmingham with the letter A, PRCO or house officer. 5. Dr. Miller is in charge of the medical staff in the Birmingham Hospital with the letter B, medical director. Exercise 3. Are the following statements true or false? Find reason for you answer in A, B, and C opposite. 1. A medical graduate becomes registered 2 years after graduation is false. 2. The system of training doctors in breeding is called the Foundation Program. It's true. 3. The name senior house office is no longer used in breeding. Is true. 4. The consultant is usually the first doctor to see new patients. Is true. 5. When working in shift, all doctors take turns to be on call. Is true. Exercise 4. Complete the text of Pierce AO describing her job. Look at A, B, and C opposite to help you. When I get to the work the first time, I do is talk to the house officer who was on duty during the last shift to find out if there have been any new leads. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, register any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her work runs, and I have to make sure I am completely up to date on her patients. After that, they are usually lots of time to do, like writing up requests for blood tests, and so on. In the afternoon, I have to prepare for any patient who are admitted the next day. There, there's usually happy to be going home, and then of course there are the lectures and tutorials in the foundation program on Monday and Wednesday. Chapter 7. Exercise 1. Complete the sentence. Look at A, B, and C opposite to help you. 1. Someone who specializes in delivering babies is a midwife. 2. Someone who has qualified to assist nurse is a clinical support worker. 3. Someone who is not qualified but is able to assist nurses is nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who has specializes in health promotion is a health visitor. 5. A nurse who looks after a ward is a charge nurse. 7. A nurse who works in the community is a district nurse. 8. Someone who answers the ward telephone is a ward clerk. Exercise 2. Make word combination using a word or phrases from each box. Look at the opposite to help you. 1. Carry out a procedure. 2. Change a dressing. 3. Check the temperature. 4. Give an injection. 5. Remove sutures. Exercise 3. Complete the sentence with the correct grammatical forms or form of perform. 1. An isotope brain scan is painless and easy perform. 2. Biopsy of the pancreas performed last March. 3. If the patient's condition deteriorates, a laparoscopy should perform. 4. A diagnosis of meningitis is suspected, a lumbar puncture must perform. 5. Last year we performed a randomized double-blind group study. Exercise 4. Complete a sentence with the correct grammatical form of carry out. 1. I knew intend carry out a larger study. 2. Unfortunately, few properly controlled trials carry out so far. 3. A number of studies carried out recently to look at these questions. 4. A right imacolectomy carried out and the patients made a full recovery. 5. The procedure can carry out in the emergency department.